On today's Finishing Well, we have insights into Medicare. Now, that may not sound terribly interesting to you, but if you really consider it, now, the show Finishing Well was certified financial planner Hans Scheil, and it's brought to you by the complete Cardinal Guide. Now, if you were to look on the front of their book, they show a picture of all things a cardinal and his little nest of eggs. Fortunately for the cardinal, he doesn't have to understand Medicare. God gave him within his DNA everything to finish well, to be able to figure out how to take care of all those little eggs in that nest and how to finish well. But inside our DNA, God did not give us all these insights in the Medicare. But if by listening to today, I think you will not only find this fascinating, as I have over the last 10 minutes, what I've learned about Medicare blows my mind, Medicare supplements and things along those lines, that really God has given us the truth in some cases, and that truth will set you free. And I really feel like, Hans, I've been set free to understand a little bit about Medicare after this discussion.
Well, that's great, Robbie. I mean, Medicare is important, and it's going to become important when you're 65 or over. And if you're sitting here listening and you're saying, well, I'm not 65 yet, what does this have to do with me? You ought to take a look at this stuff for your parents or your in-laws, or at least talk to them about it, because they might be paying way more than they need to for their Medicare supplement insurance.
Yeah, and for me, 5 years ago, I wouldn't have had a clue what Medicare supplement insurance is. But for those who are just hearing this for the first time, what does that mean, Hans?
Medicare supplement insurance?
Yeah.
Well, what it means is when you have Medicare, you've got deductibles and co-payments. I mean, we talked on the last show about Part A, Part B, Part C, Part D. So we're not going to get into all of that today. And you can go back and play that the last time, or you can get my book if you want to get up on that. We kind of zeroed in this time on Medicare supplement insurance. So what we're talking about is an insurance policy to pay the gaps in Medicare. Sometimes it's referred to as Medigap.
Right, because what I heard from my mother-in-law, actually, she would talk about this donut, and I found myself in the donut hole, and I'd been a hole, so to speak. But this is a fascinating subject, and there's a lot to know that really doesn't take a whole lot to learn.
Well, it doesn't. And so I sat down here before the show, and I said, I'm going to try to explain this to Robbie, and I'm going to try to really just see how long that takes and really take him perhaps to a deeper level than I think that a listener needs to get to even shop or buy Medicare supplements. But, you know, what we did is I showed him in the book, in the workbook on page 22, and by the way, you can download all the chapters of the book and the chapters of the workbook at my website, cardinalguide.com. So you don't even have to buy the book to see this information. We give it away for free. And so if you got into the workbook download on cardinalguide.com under Medicare, and you go to page 22, and I had Robbie do that, and we're sitting here looking, and I explained to him on page 22 and page 23 the difference between an F plan and a G plan. And I don't want to take up a whole bunch of time this morning, but these policies are the same with every single company. So in other words, these were standardized clear back in 1990. So if you got one of them, if you got an F plan from one company and you got an F plan from another company, we're talking about exactly the same thing.
Apples to apples in every single case. The coverages are identical.
This is even Gala apples to Gala apples.
That's right.
I mean, this is identical. It has to by law. So you say, well, what's the difference? Why would I pick one? The prices can be radically different, and we don't so much want to get into the pricing. We can do that. And in my book, I do a little bit, but what we can do...
I'll give you a little bit of a hint. He has a lady by the name of Ruth who apparently was 70 at the point, and she didn't smoke, and he tells you all this stuff about Ruth, so we'll know who she is. But he gives her these plan prices. And for Ruth, who was 70, I mean, in some cases, it was more than double
Well, yeah, just as an example, on page 22, the least expensive F plan is $119.79 a month, and the most expensive offered in this example is $288.22 a month for exactly the same thing.
Right. And so here's the situation. All of us have somebody we know probably on Medicare, and I'm going to guess that they didn't know that there's this huge disparity in pricing, but they can easily switch policies, especially if they're in that window, which I think people need to know about this window, because I didn't even know. But now the Cardinal might fly in your window, but this is a different window.
Well, yeah. And so what I want to point out is that just by looking at the pricing doesn't mean you're switching policies, because people hold their Medicare supplement policies very near and dear, even if they're paying too much for them. And I'm going to tell you why, because Medicare and your supplement, especially if you have an F plan, it pays so well. I mean, you can go in for a $20,000 hospital bill and a $20,000 Part B and outpatient and doctor bill, or a total bill of $40,000. And between Medicare and the supplement, if you have the F plan, in many cases you owe nothing out of pocket. Of course people are happy with that. And so this will draw them to just year after year after year pay too much for their supplement when they could cut their price substantially by just shopping.
Yeah, it's really eye-opening, and to think that, wow, you could open up some other financial resources to do other things when you're trying to finish well, just by looking at what might be available and at least shopping and getting an understanding.
I'm going to tell you who finds out about this and who's the most angry about this, Robbie, are the very well-to-do people. Because, frankly, they've got the money to pay $250 a month for something they could get for $125. They just have that. And I'm going to tell you how they got there. Is they responded, somehow the one company salesperson got a hold of them. And their one company charges more than the market does. And the salesperson sold it to them perhaps years ago, and they've been real happy with it. So they just have no need or really no desire to shop. And what you need to do is you need to find an independent agent, somebody who represents several companies and uses a rating service like I used when I created this book. And we make the rating service available to not just our customers, but to anybody, to all you listeners. If you go to cardinalguide.com and you go under the 7 Worries tab and you pick the Medicare worry and you click under that, you'll find a rate calculator that just comes up. You can put in your zip code, your gender, whether you smoke or not, whether you're married or not, and it'll calculate a rate. It'll be something just like page 22 in the workbook. Same place you find the workbook chapter, you'll find that. You don't even have to tell us who you are. So you can get a printout. There may be some variance, small variance in that, but it's going to give you the general idea, and you can put in the plan that you have now. Or you could just plug in F plan or G plan. I think it defaults to G. My point is you can see this spread like we have on page 22 for all companies that offer this stuff in your zip code. And then you can find you somebody local up there that represents that company. I mean, you don't have to buy it from us. And if you certainly found it in your heart to do so, we'd be glad to serve you. And we can do all this stuff over the telephone. But again, the purpose of the show is not to sell you insurance, and we don't really operate that way as well. What I want to do is I'd really like people to read my books and read my materials, listen to the show, and I'd like you to get something out of it and get some real consumer-oriented learning.
Right, because there's a situation, I'm sure with a lot of people, that, and again, I found out through my brief lesson in Medicare supplements that there's A, B, C, D, E, F, G, H, and I plans. So there's a lot of variation as to what you could do. But just listening to what Hans would tell me, he would say, oh, okay, well, this one would make the most sense based on my budget and my needs. But then here comes the piece that I think is critical, is that I'd listened carefully, I would have been able to save enough money to help me with long-care health insurance or long-care term insurance what am I saying?
Long-term care.
Long-term care
Yeah.
insurance that really could affect, my family and my life and those kind of things, just with the money that I saved right here by understanding what I was doing.
Well, I mean, what you just talked about is financial planning. I mean, that's what we do. And that's where my real heart is to sit down with all the subjects that we work with and look at your whole situation. And Medicare is just one piece of that. But it's really where we meet people, because people can kind of test the waters with us by buying a Medicare supplement or looking at buying one. And then the money we can save you, and I'm not going to promise that to everybody that we can save you money. Some of you have already figured this out, but that's going to be one of the areas, and creating a savings there can give you some money, first of all, just to stick in your pocket and spend on groceries, but it could possibly be used for premium for some other area. So, I mean, we've got Medicare to look at, long-term care. We look at life insurance and estate planning, your IRAs, your retirement income, your Social Security, and all this stuff mixes together like soup. And what we've got to get out of that is a living and a lifestyle for you and your spouse for the rest of your lives, and then, possibly and probably leave an estate to your children. So we're going to figure that out. This is just one piece of it, but this is like a slam dunk, Robbie. I mean, this is just like one of the places, and teaching my very well-educated young people that work for me, they all want to get into this sophisticated stuff, and we're going to go to the Medicare, and we're going to start there with somebody that's on Medicare. We're going to meet people where they are, and we're going to go over and we're going to serve them in this. We'll get to the sophisticated stuff later. This is the first place to meet people.
We're demystifying Medicare today on Finishing Well with certified financial planner Hans Scheil in his book, The Complete Cardinal Guide to Planning for and Living in Retirement. There at cardinalguide.com. We got a lot more coming up. Stay tuned.
Thank you.
Oh, wonderful. Wonderful.
Okay. So I think on the second section, we want to leverage back, we want to talk about the Social Security telling you that Medicare doesn't give you, well, maybe we go to the, Medicare doesn't give you much for long-term care. Then we can talk about the little bit that they do give you. Then we can jump to the place on the Social Security statement that where it's Social Security telling you. Okay?
Right.
Does that sound good?
Sure. Where do we go? Because I'm not guessing that's going to be the whole
segment.
segment.
Well, we could talk a little bit about the difference between a Medicare Advantage plan and a Medicare supplement in traditional Medicare, because you got a whole other option for this, which about half the people are on, which is what's called a Medicare Advantage plan. And that's where you're now getting your Medicare from an insurance company.
I get it.
You
Yeah, I know
say-
exactly what that is.
And then we might just tell people a little bit about what because we may have somebody listening to that has that, and that whole thing just confused them. So maybe we'll just give them, when we're opening, like a minute or two on that, and then we'll jump over to, that's going to confuse them, don't you think? Or what do you think? We can transition pretty well. Then we'll jump over to the subject of like Medicare and long-term care is what we're really, and payments for long-term care, and then we'll say, this is what you get, and then we'll talk about what the Social Security Administration has to say about it.
And they're called Medicare, what now? The
Medicare Advantage.
Wow. Okay. Welcome back to Finishing Well. Today we're demystifying Medicare. Finishing Well with certified financial planner Hans Scheil with a complete Cardinal Guide to Planning and Living for Retirement. And Hans, there's one of the mystifying places of these plans when it comes to Medicare is this idea of a Medicare Advantage, which I don't guess it's a big advantage for many, is it?
Well, it can be. It just depends. We don't want to make this decision for you. So when we talk Medicare Advantage, first of all, unless it's a special situation, you can't even buy one of those right now. Okay, the only time you can change into or out of or change Medicare Advantage plans is in the fall of the year. That's the time of year you turn on the TV and that's all you hear about is Medicare. It's just over and over in the radio. And, they're talking about Medicare Advantage plans. They're not talking about what we talked about earlier on the show, the Medicare and the Medicare supplements. So what a Medicare Advantage plan is you're getting your Part A and your Part B of Medicare and your Part D from a private insurance company. So your Medicare is going to be paying them, and you're going to be choosing that. So Medicare pays them every month a pretty substantial sum of money to take you off their hands, okay? And so you're now, I don't want to name companies on the line, but we represent all of them. We sell these to people, and when they're right. And so you're now...
Where's a situation where that is an advantage?
Well, first of all, is somebody who can't afford a Medicare supplement premium, okay?
$119 a month?
Well, yeah, there's a lot of people that maybe they can afford it, but they just choose not to pay it, okay? I mean, they're going to use it for something else. So these plans offer, some of them, the allure of zero premium, or a low premium, where you're going to pay nothing by the month, and then you've got their benefits, okay? Now, there's some catches on that, which we'll get into in a second, but I don't want to make them sound like they're bad. There's some people that have these and buy these, and they're just thrilled with them, okay? Now, you're going to need to go to their doctors and hospitals, so you're going to have a network on these type of things, typically, and then you've got situations, some of them let you go out of network if you want to go to a different doctor or a research hospital or something. Some of them have out-of-network coverage, and then they don't pay as well at that. Some of them don't allow you to do that, okay? So that's a big stop sign for me, me personally, because I'm just thinking if my family or somebody in my family or me personally, I get seriously sick, I want the option to go to any doctor in the country that I get referred to or whatever to solve a problem. So you've got some difficulty with that. They don't travel well. If you go to other places, you're going to need to check on the other end. But the advantage is, of course, you've got either no or low premium. That's what's really going to attract people to these plans, okay?
And so looking at the premium versus what, and again, when some of them don't know how inexpensive a Medicare supplement might have been had they heard all the options of what was really available there.
Oh, yeah. Some of these people that were paying $250 a month or $300 a month, they may have been fed up with that, or the same salesperson that sold them the plan that's $250 a month is going to come out and say, now I got one that's zero.
Right.
Hop on it, and they say, well, I got a few deductibles, but I'm saving $250 a month or co-payments. Voila, and they usually include a Part D plan. They make these very attractive. So like I said, I don't want to say they're bad. We probably sell 200 or 300 of them a year, okay? And we always present the option of them to people. And there's some people that just call us requesting it. And then there's people that are just of limited means. They just don't have the, the $125 or $150 a month, and they also don't have they don't have a Part D plan with them, so you got costs there. So it's just
it's something that, again,
it's something very reasonable. Yeah. They're typically not available in the country. You've got to be in an urban area. So you got whole areas. So we just wanted to go over that a bit so you know what you have, and we may do another later show a little closer to the season, and we'll just talk about them. Okay.
But the other big issue is when it comes to Medicare and long-term care, there's this scary thing that a lot of us don't understand about that.
Big time, okay? And when it comes to Medicare, one of the misconceptions, and I asked you this during the break, I said, do you know how Medicare pays for long-term care? And your answer was?
I don't think so.
Yeah, okay. And it took me very short order to show you that. And so what I'm going to tell you is Medicare will pay for some long-term care. Well, first, before I tell you all that, what I want to tell you is why is this important to you, okay? Is you could be over 65 and you could be relying on Medicare and your Medicare supplement to pay for long-term care. So you could be genuinely concerned about it and think you have coverage for it. What I'm going to explain is what you really have, okay? So if you have traditional Medicare and a Medicare supplement, like we talked about on the first show, you've got coverage for skilled nursing care for a maximum of 100 days. So for starters, this can't last any more than 100 days. You got to be in the hospital first, so you got to transfer from a hospital directly into the skilled nursing facility. It needs to be a skilled nursing facility, and you need to be getting skilled care in that facility. I mean, can you see how many, this and that, and, there's
if I'm not
criteria.
mistaken, you got to be making progress, or, the hospital's going to back up on you.
You got a whole bureaucracy. My mother-in-law, who just passed away about a month ago, she was in and out of these facilities and the hospital from early December, and they were out. They were putting pressure on her to either send her home, send her back to the hospital, or put her into the wing where she doesn't get any money from Medicare. But somehow she weaved, and I helped her with some of that. I didn't really help her indirectly through her kids. That didn't happen to her. But just the point that I want everybody to get is you got very limited coverage, and in the largest case, I don't want to say the best case, it's 100 days of coverage, but most people get cut off well before that. Okay?
Right, and in your book, Social Security pretty much tells you that story, right?
Well, yeah, and so in my book on the Social Security section, in the appendix, I actually put my own personal Social Security statement. So, and if you follow all the stuff I want you to do, and you read my book and you read the workbook, you can go on. It tells you in the workbook how to go get your own Social Security statement, get on, register online, get it. You used to get these in the mail without even asking for them. Now you got to ask for them. But I put my own Social Security statement in there for a number of reasons, mainly so I can explain Social Security in your decisions. But on page 4 of the Social Security statement, and by the way, it will be on yours, okay? And I showed this to Robbie earlier. It's in the original Complete Cardinal Guide to Planning for and Living in Retirement, which is available on Amazon, but you can get it through cardinalguide.com. You also can download all the chapters for free. And I'm not sure if you can get the appendix for free, but you can just look at your own Social Security statement. And Social Security, this is Social Security themselves telling me about Medicare, and it's on my statement. It just says in black and white on page 81, Appendix A, and it's the 4th page of the Social Security statement. Medicare does not pay for long-term care, so you may want to consider options for private insurance. So that was a point that I really wanted to make on the Medicare show, is here's Social Security, who administers Medicare, telling you that. They've told every one of you that's ever read one of these statements. You probably didn't pick that up, is that Medicare, they just say it pays nothing. It does pay a little something. So what I want you to learn from that is don't be relying on Medicare for care. And if you're very low income, you obviously can't afford to buy insurance protection for this. You still need to start preparing for what am I going to do if I need care, it's not skilled care, and I come out of the hospital or I go home, who's going to pay for that? How are we going to pay for it? You need to think about these things. We can help walk you through that, and even some very limited benefit insurance for home health care or for nursing care and home health care. We have short-term care policies that are available that'll give you some buffer so your family won't be stuck with just wondering how they're going to pay a bill for a home health care agency or trying to give you the care themselves. So one thing you will all learn in my shows is that as we're going through the 7 chapters or the 7 worries, the 7 subjects that we address in the books, we're just cycling through them on the show. All roads lead back to long-term care. So even though this show is about Medicare today, we're still finishing it talking about long-term care and how Medicare is not adequate in preparation for long-term care.
Right, to get into that discussion of, wow, now Medicaid is something completely different, as you've been teaching me. Where does that fit in as far as long-term care?
Well, and so what I'm going to just change the end of your question there, where does it fit in with Medicare? Because that's what the topic of the show, and then I'll answer about long-term care. So Medicaid is very different than Medicare. I mean, Medicaid is available to people of all ages, whereas Medicare is pretty much for people 65 and over. And if you're eligible for Medicaid, what makes you eligible for Medicaid is the absence of money and income. And it is basically health insurance. Now, if you're over 65 and you're covered by Medicare, and then you become eligible for Medicaid, Medicaid is actually going to take what they can get from the Medicare program to pay the first part of your bill, and then it's going to use Medicaid to be your supplement, essentially, to plug in the gaps and pay the difference. And then Medicaid also does pay for long-term care. So that answers your question. But in order to qualify for Medicaid, you have to spend down to under $2,000 a year in assets, just depending on the state you're in. And your income needs to be like less than $1,000 a month or something like that, or all going toward care. So you've got to really be, the lowest of income to qualify for Medicaid. So it's not really an option for people that have some means.
Right, and then, clearly that is not going to be the best of care that you may want for your family, whatever, as you look down what your options are as you have those discussions. Well, we've been demystifying Medicare today on Finishing Well with Certified Financial Planner Hans Scheil. And Hans, have you got a last word for our listeners on this demystification?
Well, what I'll add on your last comment was that even with Medicaid's pitfalls, I'm still very, very glad it's there. It's a blessing that it's there because it's a point of last resort, and it stops us. We don't have people, living at home being uncared for, living in the streets. If a person reaches a point and they're out of money, but they need care, in the United States of America, we're going to take care of them. So that's what it is. It's a blessing that it's there.
Right. Again, Finishing Well with Certified Financial Planner Hans Scheil, the complete Cardinal Guide to Planning and Living for Retirement. It's all there at cardinalguide.com. Thank you, Hans. Great having you again today.
Thank you.